Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Going to talk to you about the medication duloxetine. We're going to touch on the side effects, the dosage, common usages of duloxetine, some of the warnings and interactions associated with duloxetine. First off, we're going to talk about the topics I'm going to cover in this video. We're going to, of course, cover what is duloxetine, the uses for duloxetine, the dosage, the regular dosage, potential side effects, um, interactions that may occur, withdrawal, talk about if the withdrawal is an issue, some of the warnings and monitoring that is encouraged with duloxetine. So all this information in this video is for informational purposes only and is not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. What is duloxetine? It's a selective serotonin and norepinephrine reuptake inhibitor, usually abbreviated SNRI. So what it does, it essentially increases the amount of serotonin and norepinephrine, and that is what improves the symptoms that it's used to treat. In the U.S., it's sold under the brand name Cymbalta, and it's available in 20, 30, and 60 milligram capsules. So what are some of the uses for duloxetine? It's approved for fibromyalgia, anxiety, depression, muscle and skeletal pain like knee pain, back pain, that sort of thing. It's also for neuropathic pain, when there's nerve pain, a lot of people call it diabetic nerve pain. Off-label, it's used for chemo-induced nerve pain and urinary incontinence. Off-label just means it wasn't, they haven't done large-scale studies for that sort of thing, but it has been shown to help in these conditions, and your doctor or your prescriber may decide to use them for these conditions. And of course, there may be others not on this list that your doctor could use this for. So regular dosage, typically it started at 30 milligrams a day for the first week, and then if tolerated, you go up to 60 milligrams a day. Max dose generally considered to be 120 milligrams a day. It is possible you could be on 20 milligrams a day. This is just the typical dosing that we see. So what are some of the most common side effects? The most likely to occur. Headache can occur in up to 14%. Drowsiness, fatigue, 1 out of 10 folks taking this can occur. Nausea can occur in 2 out of 10 people who start this. Oftentimes that will improve the longer you're on the medication. So it's not necessarily a deal breaker. Dry mouth, 12%. And muscle weakness can occur. Oftentimes that depends on the dose of the medicine. Less common side effects occurs in less than 10% of the people who take it. We can see some increase in blood pressure. We can see some sleeping difficulty, issues with sleeping, agitation, anxiety, diarrhea. It can affect sodium. Some people can lose their appetite. It can affect their vision, sexual dysfunction, excessive sweating, itching, constipation, bleeding, rash, tremor, and flatulence can occur. Drug interactions, that's something we always want to be concerned about with medications. The big ones we watch for with duloxetine are NSAIDs. NSAIDs are the non-steroidal anti-inflammatory drugs like naproxen, ibuprofen, meloxicam, those sort of things, as it can increase the risk of bleeding. Again, with anticoagulants and antiplatelets, those are what you take to prevent blood clots from occurring. Blood clots can cause stroke, heart attack, that sort of thing. So duloxetine with those can increase the risk of unintended bleeding. Triptans are used for headaches like Imitrex and sumatriptan. Can cause some interactions there, so it would be used with caution. Antidepressants can put one at risk of serotonin syndrome, as well as tramadol. These are they are sometimes used together. They need to be used cautiously, and you need to be aware of potential side effects. It's best to avoid them if possible, but in some situations you may need to use them together. And there are many other drug interactions too many to cover in this video, but make sure that your pharmacist, your doctor, they're aware of the medications you're on so they can screen for potential drug interactions. Withdrawal can occur with duloxetine. Typically, it seems like if you've been on the medicine longer than 3 weeks, it is best to taper the dose. Typically, over 2 to 4 weeks. If you do stop it abruptly, things that can occur, people report nausea, vomiting, diarrhea. So just your GI, your gut just does not feel well. Headaches, sweating, chills, tremors, and others. So typically it's going to be slowly tapered if you've been on it a while, but you're going to stop the medication. Some of the warnings, suicidal thinking and behavior, that can occur with anything that has an antidepressant effect. Extremely rare, but we do need to be mindful of it and contact the healthcare provider immediately if we're having that sort of thinking. It can affect the liver, so liver toxicity, fainting, or low blood pressure. That can sometimes occur, especially when you first start it, and right with that. So that would kind of where that risk of falling comes in. Serotonin syndrome, we kind of talked about that. If you use this with other antidepressants, we're talking just really terrible feelings, some tremors, seizures, that sort of thing that requires immediate medical attention. It is extremely rare. Bleeding risk, we sort of touched on that. Severe skin reactions can occur. If that happens, of course, you want to seek medical attention. It can impair gastric motility. Just means it can affect your digestive tract. That does seem like diabetics are more likely to have that. So if you're taking this and it just, your stomach, you're having stomach issues, digestive issues, be sure to follow up with your doctor. It may affect blood sugar, so we have to be cautious in diabetics and monitor for that. Can affect, could cause seizures, especially for those at risk of seizures. Mania, hypomania, so folks with bipolar disorder, this may not be the best choice for them. High blood pressure, so we want to monitor blood pressure as this can increase blood pressure. Increased risk of fractures, we kind of already touched on that, and needs to be used real cautiously with poor kidney function. So typically the things your doctor is going to monitor for will be your blood pressure, mental status, again, watch out we don't have any suicidal thinking. Glucose levels, very important, especially if you're diabetic, pre-diabetic, we really need to watch it. Kidney function, again, a lot of diabetics may have moderately impaired kidney function, so we need to keep an eye on that. Liver function, best not to drink alcohol with this medicine, as the alcohol and duloxetine together can be hard on the liver. Electrolytes, that your doctor will monitor for that. And ocular pressure, we touched on that a little bit. It could increase the risk of pressure in the eye, so regular eye checkups, exams, that sort of thing, a good idea with this medication. I do appreciate you watching. Make sure you like and subscribe if you appreciate the content I produce. I really appreciate it when you do that. And go ahead and ask questions below. I'll do my best to answer them for you. Thank you for watching.